everybody. My name is Dr. David P. Perrodin, and I am your instructor for Educational Leadership 655 Pupil Services in La Crosse, Wisconsin at Viterbo University. Welcome to the week 4 Fireside Chat. This week begins Monday, February 12th and concludes on Sunday, February 18th, 2024. A recap: your SWOT assignment was due on February 10th. I will download those assignments, print them, grade them by hand, scan them, and return them to you within 2 weeks. I will also make an update in the gradebook and post that to class after the grades have been entered. The SWOT is a versatile tool aimed to convert one or two opportunities into strengths. So once you're actually using it, that is the purpose of the SWOT. Good job looking into CESA services that are currently contracted by your district and also browsing the EANS tool that was posted in class to check for the different services offered by CESAs, including mental health, trauma, sensitive schools, and staff mentoring. As Rachel, an RSN, Resource Network person, expert at a CESA shared, you should approach your CESA if you need services that are not on the menu, such as allergy management. We are moving rapidly toward outsourced professional development with CESAs, especially in schools with under 1,000 total student enrollment, which is most of the schools in Wisconsin. What might that mean for PBS? Not PBS TV, positive behavioral supports, or nonviolent crisis training? How will the CESA content align with your district content? I also hope you had the opportunity again to explore that CESA EANS link that takes you to the different organized resources. That is more searchable, and it is growing. It's informed by the districts, what they need, CESA creating then services to match those needs. It's really spectacular. And again, it's rather new. That didn't exist 5 years ago. So go in and check it out. It's invaluable to you as a pupil services director. Collaborating with your neighboring districts for professional development and support is invaluable. This is also essential to ensure mutual aid in the event of a sentinel trauma event at your school or at one of your neighbor schools. Aim to make connections with at least 2 people in your neighbor schools or local agencies to help ensure you maintain a reliable contact person if or when those sites experience turnover, right? People leave, and then it's like, I have this person I was working with, well, they're gone, and now you have to start over. So there's a benefit to have some redundancy in working with a couple people in these agencies or in different districts. Learn how your district contributed to the community health needs assessment. And will you, yes, you, be the representative the next time the community health needs assessment convenes? I think it's every 3 or 4 years it needs to convene, produce a new assessment. Mental health, access to medical, poverty supports, truancy, migrant families, all areas included in that community health needs assessment. Again, and that rests on the shoulders of the medical folks to put that report together. Week 4, shout-outs. Rachel shared that as a resource network professional with CESA, that she asked her districts what their needs were, and she posted a list of those needs. A few of them: best ways to utilize paraprofessionals, positive behavioral supports, law updates, Act 20, and that is science-based early literacy instruction in universal and interventions. And she's also heard coaching and professional development for new and emergency licensed teachers. That is excellent, Rachel, right? You want to be informed by your clients, right? By your districts as a CESA. And that's an evolution of the CESA model from my time as an assistant special education director at a CESA 20 years ago. We had more of a menu, and you picked off the menu. There wasn't much ordering outside of the menu, and that seemed to kind of work. But now it is much different. It is informed by the districts. Thank you so much. Again, ask the districts to inform the services. And if there's something you feel as a director that the CESA could help you with, bring that forward. If it doesn't exist, the CESA can explore creating it. If you have the need, it's likely your neighboring districts and other districts have a similar need. Wouldn't it be cool to have kind of a toolbox of resources? Maybe like CESA was the clearinghouse, the state put some funding into it for positive behavioral supports or onboarding of new emergency licensed staff. I guess emergency license isn't the term you're supposed to use right now, but all would be kind of cool things. Audrey, shout out. Audrey researched contact information in DPI's directory and made a noteworthy observation. Each Wisconsin public school district is required to have a homeless liaison. A quick scan of the district contacts shows me that this role is represented by different people in districts I serve, including district administrators, principals, Title I reading specialists, and counselors. The role of the guidance counselor varies from district to district. Yes. Oh my goodness. So if you look at this, there's a lack of inter-rater reliability of who is assuming these roles across districts. So I appreciate that you researched that, and I appreciate your post. Certain districts, especially smaller districts, these become add-on roles. So you're the elementary principal, plus you are the homeless liaison, plus you're this, plus you're that. So where those are standalone positions, and maybe standalone or even a department position in a larger district. I had a friend who was the superintendent of the Washington Island School District. You probably know it. It's up in Door County, and you have to go across a ferry to get there. And I think there were like 40 or 50 kids. And he had all of those hats that he wore. In addition to superintendent, he was principal. And when it snowed outside, he would go out and shovel the sidewalks. And they didn't have a lunchroom, but they did have, I think, 4 or 6 microwaves available. So during lunchtime, he also was overseeing that. So again, many hats in those positions. And what happens is people then tend to operate in silos because they're doing so much. They don't even know what the responsibility of the job is. And that's a good point. Look at your job description. I was talking with a new director last week, and the director said, I did not know that X, Y, and Z were all part of my job description. It seems like it's not exactly typical to the Pupil Services position. And I said, yeah, I kind of agree with you on that. So look at your job description and figure out even who is doing these roles. Again, it's not uncommon in one of my classes for somebody to say, wow, I didn't know that my job was to be the homeless liaison, or I didn't know my job was the safety person to submit January 1st to the Department of Justice, the report for our district and our blueprints and all that. I didn't know that was me. So look at your job description, try to figure out these required responsibilities and how that is divided across your district, especially, again, if you're in a smaller district, 421 districts, the majority being under 1,000, it's likely that you have additional roles if you're an administrator put upon your shoulders. Jamie noted that if CESA could help with anything, it would be helping to continue the development of continuum of placements at all levels within the district. I like that. I'm glad you mentioned this, Jamie, and I'm unsure that all districts are aware of the range of LRE options available to their students. Working with a CESA might not only help them to be better aware, to better map their own LRE options, but the CESA can also explore new options. I'm aware that CESA 5, close to where I live, offers several alternative schools for students exhibiting behavioral disabilities. So it expands the LRE. I will instruct the Summer Educational Leadership 654 class this summer, the exceptional learners, and in step with how the previous instructor taught that class, we'll be completing an assignment to map a district's special education services, including LRE, least restrictive environment options. Furthermore, I've read legal suits centered on FAPE where a district only considered, per what is written in the IEP, one placement, the unit placement. As a director, I recall documenting consideration of 5 or more LREs for students presenting with more complicated profiles, and making sure that was in the IEP, that we had clear consideration of multiple LRE options. Tasha wrote, in our district, which is a very large district here in the state, we have partnered with Ascension Medical for Healthy Smiles and implementation of the dental program offered in CESA. This program provides students with biennial dental exams only for those whose parents sign the written consent. Accessibility of such a service also speaks to an important vacuum for the students who may not be able to receive regular dental care. Tasha, thank you for posting this and also expanding this question out beyond the CESAs, beyond, so we get into other services that can come in. And this is clearly a pupil services area, so thank you. Dental care is often omitted from medical coverage plans, or a high deductible presents a barrier. On top of that, there's a challenge to find providers. So I'm also curious, I'd like to know the story, how this got started, what the impetus, the catalyst was, the energy in the room, and who the people were having this discussion. That this originate from the medical community or from the school community or through an early quasi community health needs assessment. So to kind of figure out the origins, because that's a big move to offer something like that. It was started here in the district where my children attend school. Maybe 12 or 15 years ago, that was brought in. So I think, again, it's amazing. Thank you for bringing awareness to that partnership. And it clearly is in the pupil services realm. But if we were to ask people to map out what pupil services does, services and programs are probably going to overlook that. So again, thank you so much for sharing that. Week 4, looking ahead to week 4. Dun, 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 dun. All right. Mental health, trauma sensitive schools seeking student input. In Moodle, suicide prevention resources address this at the beginning of your school year and again mid-year, and make sure you document what you've sent out to staff, how you've trained staff, so you have those materials. CESA also offers this training. Also consider how staff will educate students about signs of suicide in your district suicide investigation protocol. Be very overt with that and redundant. Again, by mid-year, there's some fatigue and entropy, so bring in a robust reminder of that. And also you have new students, new faculty, new families joining your district all the time. So start of year and mid-year, and document that. DPI's trauma sensitive schools, the online professional development for that is robust and it's free. So take advantage of it. The CDC School Connectedness is a tremendous website, tremendous resources, and understanding how the YRBS Youth Risk Behavior Survey fits in with that. The Wisconsin Indian Education Association, UW-Madison's Multicultural Student Center, which has outreach also included in Moodle for this week. Reflective teaching annotation, understanding the capabilities and limitations of your assessment tools. The YRBS is not a mental health assessment. It is not a mental health screener. School staff typically are not trained or licensed to diagnose mental health conditions in children. We are in a time of disruption with OHI, 504, long COVID, and the roles of teachers will catch up to this change. But right now we've got kind of a lot of quasi wonky stuff going on. Again, the YRBS is not a mental health assessment or a mental health screener. It's meant to be more global on identifying trends, right? Student-to-student relationships have become more and more complicated in our time of social media. Counselors, your SRO, your local district attorney should inform students of consequences of harmful relationship and posting compromising images online. I think it's a good idea to get out ahead of that, to present that in small groups to students, the consequences of that. In the syllabus, or the syllabus, I guess. Read chapter 1 of School of Airs, how thinking about a bagel can get you through the worst day of your life. What does this mean for authentic experiences for students? Will the metaverse increase experiences or shrink them even more? About the pros and cons of virtual reality field trips. They can be very inclusive, right? Or maybe exclusive. I don't know. Read my article about Abeyance Agreements that was featured in the November 2022 issue of Phi Delta Kappan. Be informed about Abeyance Agreements and that they do not originate from educational law, and they could be discriminatory practices if used to deny students services. Expect more scrutiny upon this practice. Read the law note, the legal note by Rachel Cox, written for Pritzker Law School that was published. That is in this week's materials. Personally, I am opposed to abeyance agreements, but I understand that they are widely used in schools and there are some arguable merits, but you're also destroying a potential student record. Read through the materials that I've posted so you're fully informed of these abeyance agreements or quasi pre-expulsion or the different named second chance agreements that are out there. And as a pupil services director, understanding how those agreements might actually make it so certain patterns of behavior, maybe patterns of discrimination, don't surface within a specific school building or within a specific district. All right, everybody, you have been doing a tremendous job posting to this class. I very much appreciate that as the instructor